You have tuned into The Voice of Medicine, the medical podcast filled with remarkable stories, first-hand experience, important research, and valuable life lessons. Open your mind, relax, and enjoy. Dear ladies and gentlemen, welcome to another edition of The Voice of Medicine. I have the pleasure today to host Dr. Mohy Taha. Mohy came a long way from Cambridge University over to Charité in Berlin and University of Zurich. And since 2017, he works as a consultant in orthopedic surgery in Basel, Switzerland, at the University Hospital. Mohy came up with an amazing idea which he will share with us today. Basically, one could say that his idea revolutionizes the way how doctors get their fellowships.
Hi, Michael. Thanks for inviting me.
A pleasure. Mohy, you had quite a journey behind yourself in terms of medical education or education in general. You've been to several countries, not only during your fellowship, but already before. Would you say that you are a prototype of an international doctor?
I totally agree. I mean, I grew up in Cairo, which is also a big city, which is also international. My school was an international school, so I had already contact with a lot of nationality, people from different cultures. And that's how it started, my relation to the international world. And once I finished my school and went to medical school, just by chance, I joined the International Federation for Medical Students Association, which is a non-profit organization. And its job was planning, exchange, observership for students. So it was run by students and it was done for students. And that was my second contact to the international world of medicine. And that took me traveling everywhere. I did my very first observership as a student after my third medical school in Berlin, in Germany. I didn't speak a single word German, so I was there with my English, communicating with the people. And I liked it so much that 1 year later, I did my very first research fellowship, and I stayed 1 year in Berlin at the Charité University Hospital.
You must be a very persistent personality, because if the German grammar did not break you, nothing will.
It was tough. I had to take a German course 3 hours per day. So I was in Berlin and not really enjoying my time as much, because I was in the lab in the morning and then from 6 to 9 p.m. every day, doing my homework and visiting my German course to learn German. It was a tough language for me.
I had a couple of really great and inventive minds on my show so far. For example, I had Carrie Burnite, who came up with the idea of GrandPad, making an iPad or any kind of tablet device more secure and usable for all the adults. Then I had a talk with Luisa Dobre, who came up with the idea in Comet Health. She basically revolutionizes communication. It's sort of like a secure, data secure WhatsApp for doctors. And now I have you. And I would like you to tell our audience what you creatively cooked up in MyFellowship. What is that about?
The whole MyFellowship platform, it is actually created because of the needs of fellows and people. I saw the problem. My very first problem was I wanted to do a fellowship in Australia during my medical training. I was in Belgrade University Hospital. I was in my training, and then I decided to go to Australia once I finished. And that was exactly 2013, at the beginning of 2013. So I said, okay, where should I go? And then I started, like everybody, Googling, fellowships. And then I found a pretty good website, which is from the Australian Orthopedic Association. But then going to the website, and then I found the very first problem is even the search mechanism on the website was very hard, because all of the fellowships, they were recorded in PDF forms. So you couldn't really filter any information. You couldn't really look specifically. All what you could do is just put a specialty and region of Australia. So you get lots of unspecific results, and then you have to click yourself through all of the PDFs. So I had to go through all of the PDFs, extract all of these PDFs, put them in an Excel table, so that I have an overview
Wow.
what's available.
That does not sound user-friendly whatsoever.
No, it was hard work, and it took a couple of days to finally find the shoulder and elbow fellowships which I was looking for in Australia. And I just was looking in Sydney, Melbourne, and Brisbane, and I found like 29. And then it was like, okay, now I have 29. Where should I go? And I didn't find any information, any feedbacks about these fellowships. I didn't know anybody who did a shoulder and elbow fellowship in Australia before. I knew a couple of people who did a trauma fellowship. So the search process was already hard. So I started emailing all of these centers, it was 29, and then started to do appointments for interviews. So I took 4 weeks off during the summer vacation, took my wife, 2 kids. We flew to Australia, and I did 13 interviews. It was also costly. And I had to decide, okay, where should I submit my application? Because if you don't have information, I wanted to take an informed decision. If you go now on holidays, you go and look into websites, feedbacks, which hotel are you going to book, see feedbacks, and then decide. And you are investing like 1 week of your life. So if I am going to go with my family and wife and kids and change their schools and pay that much money and invest and leave my job and do all of that. So I found I had to have more information before deciding where to go. So I went through these 13 interviews, and as I expected, I had different expectations that the fellowships were providing. But I found 4 fellowships were providing what I was looking for in a fellowship.
From 13,
and finally,
from the original 13. Okay.
Yeah. So I started with 29. Through the emails, I was able to filter them till 13. Then I went for interviews in 13, spoke to the fellows which were currently there to decide, if that's what they are receiving and what they are experiencing is the thing I want to experience in my fellowship, yes or no. So I had a couple of questions which I asked everywhere to every fellow I met. And then I had my rank, my Excel table, and then I was entering the point, yes, no, checklist to be able to filter them. And then I got accepted, luckily, in 2 of them. And then I went 1 year to Sydney and 6 months to Brisbane.
So from the starting position of wanting to, find the right fellowship, basically, standing in front of a mountain of information and limited time, limited resources, lacking all tools for orientation, you went from 29 through, of course, tedious work till 2, which actually, accepted you and you said, this is what I want, and where you ended up then. Okay.
And 2 years time.
In 2 years time. Okay.
to get from the day I started contacting the people to the day I got accepted, it was like 2 years
that is crazy.
Of my life. And then arriving in Sydney, everything went well. And they took me, even after you get your acceptance and you said, okay, I'm going to come, then the actual real journey starts, because the paperwork is unbelievable. It took me like 7 months to do all of the paperwork, translations, get to the legislations, go to the notary public, change everything, do it again. They don't like the stamp you did. They need another stamp, 2 and 4th, and it was like devastating. And you are working full time. You have to take a day off to go to the notary public to get your stamps. You send it with FedEx or any mailing system, and then come back. You missed that, or you missed this. You have to add this. So after 7 months, I made it to Australia. And the first thing I did when I arrived is I wrote a whole book about my experience and how to avoid all of the pitfalls I went through, so that the following fellows who are going to join the same institute I visited can profit from it.
So you basically, you did the frontier job, as the Americans would say, because you went there without knowing what to expect, and you basically had to find your way through all these pitfalls, as you call them. But you succeeded, and by the way, there was probably no help whatsoever from anybody. I guess you did this on your own.
There were a couple of people who did similar, like people who did a fellowship in Australia. It was just not my fellowship or didn't my specialty. I had my education from Egypt, so there is still a whole set of different processes if you study in Egypt than if you study in Europe. So there were people helping, but your situation is always unique because you studied in some place, you went through some. There are people working in Switzerland who studied in Germany or studied in Austria or wherever. So there are always stuff which you miss or it's different. You have to find by yourself. You have to try. And there are plenty to learn through the way.
So this difficult experience was basically, let's call it the essence why the idea of MyFellowship was born. And where did you go from there?
That was like the basic. Like I found that problem. It was a problem. I didn't think of a way of solving it. And then came the other problem of the process. And then I thought, okay, the way I solve it is I wrote that book and give it to the fellowship coordinator. I said him, okay, whenever anybody you accept to your fellowship, just give him this book so that they can profit from it. And then the last stage, which was like the breaking point when I said, okay, I have to do something, was when I met my colleagues and peers who were doing other fellowships. One was coming from Argentina, one was coming from England, and both were unsatisfied with their fellowship, that they have to leave earlier. Like instead of 1 year, they left after 6 months because they were frustrated because their expectation and the reality didn't match. Mm-hmm. So you have this situation when you have one fellowship, one mentor, and you have 4 fellows. 3 are very happy and 1 is very unhappy. And it has nothing directly to do with the fellowship itself, but it has mostly to do with your expectation. What do you want? Why are you here? And if you have expectations which cannot be satisfied by the fellowship you are doing because it doesn't provide what you are looking for, then you will be frustrated. And it ends up in wasting your time, wasting your resources, your family, your friends, you leave your job, you go through a lot of time and money, and then at the end you don't reach what you was looking for. And that was their problem because they didn't have the available information. They didn't meet the previous fellows. Not everybody can travel for weeks through Australia to do interviews 2 years before his fellowship, and I don't expect people to do that. And
so what happens really often is, if I understand this correctly, is just there is a huge asymmetry of information, or even there is a non-existent of very important information to make the right decision. The fellowship really is, I would say, tailored to your needs, to your academical and medical needs. Okay.
Exactly. That's the problem. There information, it exists, but a lot of information which you really need to take your decision or what suits you doesn't exist. Mm-hmm. And you need to know it from people who has been there, to ask them and learn from them. And that's to see like their feedbacks. What did they like about the fellowship? Which parts? I mean, a fellowship, it's a whole experience. It's not just like doing research or just operating or just visiting a city. It's a lot experience. So it's your mentor himself. It's the facilities you have in the hospital. I mean, if you want to get trained in microsurgery and you go into a hospital which doesn't have a microscope, you will be frustrated. But this is not the problem of the hospital or the fellowship. You just didn't ask if you guys have a microscope and you do microsurgery. So it's just a small piece of information which could be missing, and then you get frustrated, but it's not the problem. So you need to take like informed decisions. And that's what I tried to do with the platform. So we have a database of worldwide fellowships available in different specialty, different areas of the world. And then we have a feedback system. So it's like a fellowship advisor where you see the feedbacks of all of those people who do it, plus the opportunities that you contact these people who did the feedbacks and you ask them specifically for simple questions. For instance, I'm going with my wife and kids. Where do I find an apartment? Where can I find a car? Which SIM card should I buy? Very simple questions, but you need somebody who tell you, hey, that area to live in is family friendly, or your school, it will be close to here, or your hospital you are working in most of the time is closer to that area. So search for an apartment in that area. And these are stuff which would be very helpful for you.
So the platform basically includes or lives from the idea that fellows who already had a fellowship are basically feeding in information about what they've been through and what they already know, sharing their knowledge and experience for people who are interested to go on a fellowship somewhere. Okay, do you also work with the clinics and hospitals? Do they feed any kind of information? And also another question which I have is, so how do you have basically the list of the fellowships? I mean, do they submit to you, or do you have somebody working this out? So going through the data, looking for what fellowships are where, taking care of it.
That's an excellent question. Thank you for asking. So our concept is basically that this is an open source encyclopedia. So it is an example of Wikipedia, but for fellowships. So it is open source, it's for free for institutes, it's for free for doctors, so none of the users pay anything. So the idea is sharing. Sharing is caring and connecting everybody through that. So previous fellow can mentor future fellows, they can connect to each other, they can grow their network. New fellows coming there, they can look, search the database, find the fellowship. After they finish the fellowship, they write their feedback. Institutes who are interested in putting their fellowship on our platform, they can go ahead and add it. So it's free, it's open source, it's open for everybody. We don't really control it in meaning of who is putting what where. It's available. People who want to use it, they are more than welcome to use it to help each other to achieve their targets and have opportunity without being frustrated at the end of their fellowship.
How do you finance the platform?
It's self-financed. So it's actually through me and a couple of friends who I went through and they said, hey, I have this idea. And all of these are fellowship-trained doctors. So they have been through the process. So they know the problems. And they said, oh, that's genius, because till now, we didn't have any solution. And we had to go through the same process you went through. That was also very fascinating for me, because I thought, maybe that's only my problem. But then when you talk to people and say, yeah, I had this problem as well. And you talk to everybody and you find that everybody has the same problems, but nobody thought of how to solve the problem. And that was my part where I said, okay, I'm going to solve it. We do this and that and that. And after that, it was when you go to I'm a doctor, so I don't have IT background. I don't program anything. So I went to an IT company and asked them, I want to do this project. I have this problem and I want to solve it. And these are all of the options I want. And then they looked at me and they said, okay, you're crazy. We won't be able to do that. And I told them, I want it through within 3 months. And they said, okay, first of all, that will cost you thousands and thousands. That will cost us months and months of development. You cannot just simple as that get TripAdvisor with LinkedIn, with WhatsApp and Facebook and all in one within 3 months. So you go ahead and think about it specifically, which options do you want and which priorities, so that we can develop one step by step. And I said, okay, that's now a tough question for me, because I actually know the problem, but I'm developing it for the people. So I don't really know what all of the people want. I want what I want or what I missed. And then I came with that idea of doing the landing page, doing that survey, which is very simple. 3 main questions. Which options do you like in our platform? Which, to develop, for us to develop, we need to know exactly what people want the most, so that we develop them sequentially, one after the other. And that's where I decided, okay, we do this project for the people. So we ask the people, what do they want, so that we develop it according to their need. And that's where I started the initiation of the 1,000 survey, trying to get as much people involved from as many countries as possible, because what we need in Egypt or in Europe or in the States is not the same. Each country has a different problems. Each one has a different view. Each one has a different need. And to apply all of that in one platform, you have to know what their needs are.
So, but I see you're not only a visionary, but also an altruist. I mean, financing this by yourself for your colleagues, for your medical colleagues, basically around the world. Well, at this point, you're very kind. Thank you very much for doing that, in the name of all the people who are able to use it. I'm grateful that there is, people like you out there doing such good work. And I really hope that by time, with some time, people are going to recognize what kind of a huge asset it actually is for all the people. And maybe you can, get on crowdfunding as an idea of financing it. Another thing which I wanted to ask you is, so do you see, for example, a difference in the structure of who are the doctors that actually go to MyFellowship, or who are part of your network? So is there a difference in nationalities? Do you have, majority from Latin America or Asian doctors, or is there any difference in this?
Yeah, When we go through our statistics, I mean, we publish all of our statistics on our landing page on our website, which shows our visitors, and we update it every week from which country, and also the number of surveys. I mean, we are very clear about our project. We publish everything. Our projects, our one-page project is on our landing page from day one. We have a very clear concept, and what we need from the people is to know what do they want so that we do it. And mainly, most of the people which are visiting the network is like United States is number one, then comes Switzerland, then comes Egypt. And if you think about it, like why? United States is because a very developed fellowship system where they have the matching programs. They're very advanced in this. Like almost every surgeon does a fellowship after the training. So the culture is very developed there. And then comes Switzerland, because I am located in Switzerland. My friends are located in Switzerland. That's where I did my training. And we don't have like a big marketing campaign or companies or something. We just do it through my LinkedIn, Facebook, or social media, and my friends and everybody who's involved in the project. So it's word of mouth. And that's how.
Oh, don't worry about that. Good ideas are going to spread very quickly. So I'm very positive that, within 5 years, you're going to be worldwide. People are going to know.
Thank you. So we have, United States, Switzerland, Egypt, India, Germany, United Kingdom, Colombia, Australia, Canada, and France. These are like the top 10 on our list.
So quite colorful, from the nationalities. It's I see that everybody's kind of tapping into it. And I was actually very surprised to hear that Switzerland is among the countries which have, good fellowships structure. For example, I didn't know that. I have to admit that. So, another question, perhaps a little bit personal, but did you become a sort of a starlet, or sort of like a celebrity among your colleagues since you're doing this?
I don't know. I didn't look after it. I mean, I didn't really mind. I don't mind actually me myself. It's about the project itself. So the main issue is that the project gets famous, not me. I'm doing it for the people so that the people use it and profit from it. So it's not about me. It's about the people and the project. So I don't look after it. I don't really mind it. It's not my target. It's the project, and my satisfaction, or the most satisfaction, is that when people use the platform and enjoy it, and they said, hey, you helped me out through my fellowship, although I don't know these people. Because at the moment, it's like you get one-to-one contact. The people I know who ask me, how was it in Australia? Should I go? Shouldn't I go? What's your recommendation? And I want to move it from just being personal connections so that everybody can mentor everybody and people can profit from each other, because you can have much more influence. Me, myself, I might treat 10 doctors, 1,000 patients, for instance. If I treat 1,000 patients through my career, but then if I train 10 other fellows and each of these treat 1,000 patients, so I improve the patient care of 10,000 patients. And that's the idea of it, that snowball effect, that everybody helps everybody, and then you improve the patient care through improving the training of the doctors. And I can do it only on a limited scale through the patients I treat, but when you also help others develop their skills and each of them help other patients, so you increase your effect.
I understand. This is sort of a hidden multiplicator, which you accounted for, which is really great. I wanted to ask you, when you went down to Australia, another little personal question, but I like, personal anecdotes from the life of people that I'm interviewing. Was there at any time, sort of like a cultural shock where you thought, wow, okay, this I didn't expect? And then on the other hand, was there a medical shock where you thought, wow, this is medicine completely done differently than I was experiencing at the Beigrist clinic, here in Zurich. So was there such a thing?
I can tell you, in every country I visit and in every place I go, like to work and medicine and visiting, there is shock everywhere. So you enter from day one, and it's not like that's what you learn when you do traveling. I mean, I did 5 full-time fellowships. I did like 9 observerships visiting doctors in France, in Canada, in the States. And Every time you visit somebody, even if you visit them for 1 or 2 days, you learn so much. You learn so much what you need to get during this observation. It's not like the skills, it's not the single skills, because you don't get skills in 2 days. But what you need to learn is the system. How do these people function? How do they run their systems? How do they run their clinics? How do they run their operating theater? And that's where the gold comes from. That's where the whole assets is. It's like, okay, there is a functioning system. What can I use from this system and implement back home? What are the stuff which are positive? What are the stuff which doesn't apply to my country? What are the stuff which doesn't apply to your culture? I mean, running the clinics in a public hospital in Australia is very different than running the clinics in Switzerland. For instance, patient get an appointment at 8, but this is not like one patient who's coming at 8, but there are like 10 patients who come at 8, and then 10 patients who come at 9, and 10 patients who come at 10, and 10 patients who come at 11. So you see in the early morning, in half a day, like 40 patients. And here in Switzerland, for instance, you have like every single patient has an appointment. He comes at patient X comes at 8, patient Y comes at 8:30, patient Z comes at 10, and so on. So it's very different. And over there, they all come, and then you take one after the other, and they don't bother waiting. They have no problem. And here, if you let the patient wait 10 minutes, you get complaints. So it's very different. And this is stuff, so for instance, you cannot say, oh, that's a good system. You see much more patients in the early morning. Why don't we apply this in Switzerland? It doesn't work like that, because that doesn't fit into your culture and your system. But there are much more different stuff which you can apply. Okay, efficiency in operating theater, how to limit or make the changing time less. So you learn a lot. And that's, I don't call it a shock, but I call it like learn from the masters. See how they do. Learn from the people. If you want to be a master, then you have to visit the masters and see how they do it to be a master yourself. And that's how you elevate yourself and how you improve and boost your career. If you just only learn from people who are like you or less than you, you will not improve. So if you want to get better, then see who is the best one in doing that stuff. Go visit him, learn from him, go back and apply the parts which you can apply to your system and culture.
That is a beautiful idea, and it very much reminds me of how apprenticeship was done, in, let's say, in the Middle Ages, where you, for example, as a blacksmith, if you wanted to be one, you started as an apprentice somewhere, and then when you were, I would say skilled enough, they would send you somewhere else to another master, to another city, let's say, to learn, the craft from a different kind of angle. So this very much reminded me of that. But I see that all this experience basically brings you to a sort of a cognitive flexibility where you start to understand maybe some structures and also, get to the underlying mechanisms and variables of different kind of procedures and everything. The last question, which I wanted to ask you, so to sort of close up our wonderful talk, is what can people do to support you, and of course the platform, even for example if they are not if they are not right now fellows, or if they're not really going to do a fellowship in anytime soon, but still, they want to support you? Or what can anybody basically do to support your idea who is in healthcare and sort of understands the stakes of what you're doing?
And there are plenty of ways actually to support us. So the first and easiest way is to tell people about us. Tell people, if you know anybody who did a fellowship or who is looking for a fellowship or who are thinking of offering a fellowship, tell them, there is a platform, go and join and help the people. So that would be number one, getting people to use it, because I went through the whole process, so I know how beneficial that is. But if you didn't go through the process, you don't know what's waiting for you. You don't know the pitfalls. You don't know what the problems that are going to face you. So just if you inform people around you, hey, that is a project which can help you, that would be a great benefit, not only for these people, but for everybody. The other thing is, even doctors who are not interested in fellowships, but still they can connect to others. They can connect to fellowship-trained doctors. They can ask them questions. They can meet up with them. They can virtually meet up with them. We have different partners who different services, like also e-courses, e-webinars, e-congresses. we have a variety of possibility how we can support people, not only through our platform, but also through other platforms which are we have collaborations with.
We will make sure that we spread the word and also, invite people to really use your platform. Mohy, thank you so much for taking your time and talking to me on my program.
Yeah, I liked it very much. Thank you a lot for inviting me, and it's a great honor for me to be on your broadcast with all of these famous people who are game changers in their fields.
Thanks you very much again. Thank you. Bye-bye.
Thank you. Bye-bye.
This was The Voice of Medicine. Make sure you tune in next time and take care.